and we will get started with the presentation. So this is a presentation on Medicaid managed care and tailored plans. Some of you may have already received in the mail. I'm just making sure we're recording. Yes, we are. Sorry about that. You might have received a packet or a letter in the mail from Medicaid, and some of you may have already done this before last year when this was originally rolled out and then paused. So we're here to kind of pick up any information that you have bits and pieces of, answer those questions, and help you to go forward. This was a little bit surprising for a lot of families to get this rollout because it kind of snuck up on everybody that they were going to reintroduce this. So we'll do our best to answer questions and help you prepare for these changes. So Medicaid managed care is the new Medicaid transformation. So you might have heard both of those terms used. They are the same thing. The enrollment for this new Medicaid starts this week, March 15th, the letters started rolling out, and the enrollment period goes until May 14th. The actual new plans that you will have will start on July 1st, 2021. So we're going to go through who's in what plan, what's appropriate, how to enroll, how to find out who you should enroll with, and specific questions about those different plans. So there are going to be two categories going forward for Medicaid recipients. There's going to be Medicaid managed care. That is going to be for the majority of people that are enrolled in Medicaid. That's going to include adults and children, people that are on traditional Medicaid, NC Health Choice, and the types of services that are going to be provided under Medicaid managed care are things like outpatient therapy, ABA, applied behavioral analysis therapy, things like developmental and behavioral pediatrics. Those are all going to be managed under those different Medicaid managed care plans. Medicaid Direct, also known as the tailored plans, is also going to be for adults and children. But these are for people that currently are on the innovations waiver, receive Cap C or Cap DA Medicaid, are in residential placements such as ICF IDD, group homes, PRTF, which is psychiatric residential treatment facilities, day treatments, intensive in-home treatments, and other type of treatments that fall into a higher level of care. Those are all treatments that are being managed by Cardinal Innovations or other MCOs, depending on what county you're in North Carolina. Those Medicaid Direct tailored plans are attached to the letters that you will get that say, you need to do nothing. There's no need to enroll. Everything will stay the same for you. You will remain with your MCO, such as Cardinal Innovations or Partners Behavioral Health. For right now, you will do nothing. But we're going to circle back around to that in a few minutes and talk about some changes that are even going to occur with that. For everyone else that goes into Medicaid managed care, you're going to have to choose a plan, essentially a private insurance company. So we're going to talk a little bit more about that. Now, what's important to know is that you may start out in Medicaid Direct, but if your child services change, meaning let's say they have intensive in-home or they're in a group home and that stops and they're no longer receiving that treatment and they're home, then you're going to be shifted back into Medicaid managed care. So it's really important to understand that you may have to go back and choose one of these plans. So it's important to know about both. It is also interchangeable that if you're currently in Medicaid managed care and it's determined that your child needs a higher level of care.
This thing, it's a special thing.
If everybody can mute their lines, please.
It's telling you about the two categories for the Medicaid thing.
There we go. If your child is in the Medicaid managed care, applied behavioral analysis, outpatient therapy, those are things that you're doing. And then it's determined that your child needs a higher level of care, or they get an innovations waiver slot or go into an ICF group home, then you're going to be shifted into Medicaid Direct. And it is possible to kind of go in back and forth between those two different types of Medicaid, depending on the treatment that your child is receiving. I'm going to play a quick video. Hopefully it will work with no issues. If it's not working, someone please put in the chat box or unmute and let me know that you either can't hear it or it's not running. This is a really short video that the state produced to help explain all of this.
If you live in North Carolina, there is a new way to get Medicaid healthcare. Most people will get the same Medicaid services in a new way, through health plans. Enrolling in a health plan will save you time and resources in getting your health care. You will have access to a network of providers. You can see your doctor as
I'm sorry, guys.
often as you need, and you will also have access to a 24-hour nurse line. You will choose a primary care provider and a health plan that are best for you. A primary care provider is your family doctor, clinic, or other healthcare provider. You will see your primary care provider for all your medical needs. If you need care beyond what your provider can provide, he or she will refer you to a specialist in your health plan. You also have a choice of health plans to fit your healthcare needs. A health plan is a group of doctors, hospitals, and other providers. They work together to give you the healthcare you need. Health plans pay for healthcare services, including doctor's appointments, inpatient and outpatient hospital services, nursing home services, prescription drugs, routine eye exams, and more. For a full list of what is covered, visit ncmedicaidplans.gov. In NC Medicaid Managed Care, there are 6 health plans to choose from: EBCI Tribal Option, WellCare of North Carolina, United Healthcare of North Carolina, Healthy Blue, AmeriHealth Caritas North Carolina, and Carolina Complete Health. Most people receiving Medicaid must choose a health plan. A small number of people will not need to choose a health plan because of the type of health services they need. They will stay in NC Medicaid Direct, or they can choose the EBCI Tribal Option if they qualify. NC Medicaid Managed Care will send you a letter that tells you if you must enroll. Here's what you need to do. Step 1. Choose a primary care provider. If you want to keep your current provider, you can ask them which health plans they work with. You can also visit ncmedicaidplans.gov, use the NC Medicaid Managed Care mobile app, or call 1-833-870-5500 for a list of doctors and other specialists. Step 2. Choose a health plan. You can learn more about the health plans available at ncmedicaidplans.gov/find/view health plans. Step 3. Enroll. You can enroll by going to ncmedicaidplans.gov, where you can chat with an enrollment specialist. You can also use the NC Medicaid Managed Care mobile app, call 1-833-870-5500, or fill out and mail or fax in the enrollment form you will receive in the mail. You will need to enroll by May 14, 2021. Your health plan coverage will start July 1st, 2021. If you do not choose a health plan or primary care provider, one will be chosen for you. You know your needs best, so it's better if you choose. After you enroll, you will receive information and an ID card. You will use your new ID card to get healthcare services. You will have 90 days after your health plan starts to change your health plan or primary care provider. If you have questions, there are several ways to get more information. For questions about your Medicaid eligibility, your local Department of Social Services, or DSS, can help. You can find contact information at ncdhhs.gov/local-DSS. To learn more about choosing or enrolling in a health plan, you can go to ncmedicaidplans.gov for more information or to chat with a specialist. You can also call 1-833-870-5500 to speak with someone. The call is toll-free. If you have questions about your health plan or specific benefits, call your health plan. You can also find contact information at ncmedicaidplans.gov.
Great, so that gave us a whole lot of information, but I'm sure if you're feeling like me, it's a lot of overwhelming information. So we're going to break this down a little bit here. Oh, got to get past there. We go. So let's really look at identifying what category you fit into. And we're going to do this through a poll. This also might be a good time if you want to grab a piece of paper and a pencil to be able to jot some notes. It might be helpful. So I'm going to start a poll. Okay, so let's go ahead and we'll go through each one of these questions. If you have any questions about not sure what it means, feel free to unmute or use the chat box. The first one is your child on the innovations waiver or CAP-C? So this does not include the waiting list. These are children that are currently receiving the innovations waiver or CAP-C. So go ahead and you can answer that. If you're having any problems with the poll, let me know. The next one is your child in a facility, an ICF group home, a PRTF, or any placement out of your home? That would also include therapeutic foster care or an acute hospitalization. The next one is click on any of the services that your child is currently receiving. So you can pick more than one. Intensive in-home is a therapy that includes 3 clinicians that are coming into your home, or telehealth right now a few days a week. High fidelity wraparound is for children with really severe behaviors or needs that you've got an additional worker. NC Start is usually typically put in place when your child has high-level services. Day treatment would be a school-based day treatment that they are receiving through the school system. MST is a more intensive therapy. Respite is a B3 service to give you a break. And in-home skill building is a B3 service that brings a caregiver into your home to help teach with those skills. ABA, if you're receiving it. And then we've got number 5, outpatient therapy, in-home therapy, speech therapy, occupational therapy, physical therapy. So we haven't had a whole lot vote. So I'm going to give you guys a few minutes here to go ahead and answer these polling questions, and then we're going to go over these and share what categories these put you into. So we're about halfway there. I'll give another minute. Again, if you have any questions, feel free to unmute or put in the chat box, and I'm happy to answer.
Hi, I think I answered all right. I am not too sure, but my daughter receives speech OT in school and private, and ABA in home. So would that ABA in home, would that be the section of therapies, one-on-one therapists, or just that general ABA?
ABA in the home, and also those, we're talking about services that are not provided by the school. So you want to answer what you are doing essentially in your home,
Okay.
or going to an office, just not in school.
Okay, gotcha. Good. Thank you.
So we've got the majority have voted. So I'm going to close that out, and we're going to go over the results. So if you answered that your child is on the innovations waiver or CAP-C, if you answered yes, that means that you are going to be placed into Medicaid Direct. So write that down on a piece of paper. If your child is if you answered no, your child is going to be placed into Medicaid managed care. So just again, write these notes down. Number 2, if your child is in a facility, if you answered yes, they will be Medicaid direct. If you answered no, they will be Medicaid managed care. Now as we go through this, if it changes where I tell you this is going to put them in the other group, then scratch it out and write the other group so that at the end of this poll, you have an idea of where you're going to be at. Click on any of the service that your child is currently receiving. So if you answered that your child is currently receiving intensive in-home, high fidelity wraparound, NC START, day treatment, respite, and in-home skill building, any of those will put them into Medicaid direct. So it will move them out of those managed care plans and into NC Medicaid direct. And I'm actually going to share results so you guys can see this too. Okay, if your child is currently receiving ABA, not on a waiting list, but actually you are doing it currently. If you answered yes, you are still going to most likely, and this is where I say most likely because there's some murky water here, depending on the amount of ABA they're receiving and how the referral came about, you may be still placed into those managed care plans. Some children that are on ABA, depending on the amount of ABA they are getting, may be kept in Medicaid direct. So for you parents that are receiving ABA, you'll want to really watch what letter comes in the mail. And if you get that letter and you're not sure, feel free to contact us or contact your ABA provider and talk about it, because there is, again, some murky water surrounding ABA. Then, is your child in any of these therapies? If you answered outpatient therapy or in-home therapy where it's just one therapist, so that's different than intensive in-home, you are going to be still placed with Medicaid managed care. Same with speech therapy, occupational therapy, and physical therapy. You will still have to choose one of these plans. Now, if the company determines that the level of need is much higher and it's a higher authorization of services, then you may be put into Medicaid direct. So it does get very confusing, and it's very hard to just determine without looking at everyone's case. I'm going to stop sharing the results, but I hope that helped you all to determine where you're at. All right, can everyone still see my screen? Can we go on to the next one? Someone can unmute and let me know if the poll disappeared.
Yeah,
Okay, thank you. All right, so we're going to dive deeper into these plans for you guys. So if you answered yes to Medicaid direct questions, you will not need to enroll. You will remain with Cardinal Innovations or Partners Behavioral Health Care, whatever your MCO is in your county that you're working with, you will remain with them and nothing will really change. And I see there's a couple questions in the chat box, so I'm going to go through the next 2 slides and then come back to answer those. So I haven't skipped you, and I don't know why there's red on my screen. I don't know if you guys can see that, but I don't even know how to disappear that. What you really want to watch for is when you get the letter in the mail, if you're not sure what to do, make sure you call someone first of all. We had, when they rolled this out the last time, there was some mistakes. And some families that should have stayed in Medicaid direct, meaning their child was receiving these higher level of services, were accidentally put into the Medicaid managed plans. So if you answered yes and you think my child needs to stay with Cardinal Innovations for the services they're receiving, and that doesn't match what the letter from DHHS says, make sure you call someone right away. There is such a small window of time here that I want to make sure that everybody, you don't want to throw that away or put it off. Call right away, because if they don't straighten this out by the time enrollment is done on May 14th, you will get put into another plan. You do have 90 days to fix it and change it, but anything with the government takes forever, and it's bogged down by red tape. And so we want to not have you be stuck in that, because the result will be your child won't receive the services. Especially if they are in a placement outside of your home, we don't want them to be discharged. So if you do stay with Medicaid Direct, you will be staying with your MCO that you are currently working with. They are going to be called the tailored plans, and they will remain the same until 2022. So we are only really looking at a year where this will all be the same. In 2022, they're going to change up all of what we're doing. And then if you also live in a county where there has been some issues with the county wanting to disengage with Cardinal, we may have some changes coming up in the next couple of months as well. We're going to talk about that more in a minute. So there's all kinds of scenarios going on with Medicaid. So if you answered yes to the managed care questions, you will need to enroll in one of these plans before May 14th. And if you don't, the state's going to go ahead and do it for you. We're going to talk a little bit more about those different plans, but it's really important to choose the right one, and don't let the state decide, because what they're going to do is they're going to throw you in who has the lowest enrollment, and that may be in a plan that none of your child's doctors or therapists participate in. So step one, make a list of all of your child's doctors and providers. So that includes not only medical doctors, but psychiatrists, therapists, ABA providers, developmental pediatricians, everybody that your child sees that is associated with Medicaid, make a list. Then what you're going to do is you're going to start out with your primary care family doctor or your pediatrician to find out what plans they are participating in. And we're going to go into that in just a minute of how you can find that out. You're also going to need to know what medical system you're in. Most of us are divided into Atrium and Novant. Atrium is not participating with the United Healthcare plan. So if you are a family that uses mostly Atrium providers, you're not going to want to choose United. Novant seems to be pretty universal at this time, but it's changing daily, and it's something that you really want to look at. And so you're going to want to research those plans and find out who's enrolled in what. So here's where you can find those tools. So there are a couple different ways. You can go online to that website right there, which is ncmedicaidplans.gov. You can Google that, or you can type that right in. And it will take you to all of the information that you need. But you will have to, if you use the computer, you have to sign up and get a NCID account, which, it's just email and a password. But it's a little bit more lengthy. The easiest one to use is the mobile app. It's super easy. You just go to the App Store. It's for Android and iPhone. Type in NC Medicaid Managed Care, and the app pops up, and it's super easy to use. So you can do your research through that app of looking up certain providers, and it will tell you what plans they're participating in. And it will also allow you to get enrolled. So the only downside to it is you're doing it on your phone, which is tiny. But it is much more user-friendly, I found, than the website. You can also call someone. The 1-833-870-5500. They have a variety of interpreters that can do different languages. So if you have a language barrier, that might be a good option for you. Or if you really have some specific questions because of the services that your child receives, sometimes the phone might be the best way to go. However, be prepared that it might take you an hour or two even to be on hold before you talk to someone. So it's one of those situations, make sure you've got some time. And then last, everyone's gonna get a letter in the mail. It will have an enrollment packet. You can fill it out and you can mail it back. You can fax it to them. But unfortunately, it's slower and you can't do any research through that. So really looking at either your online option, the mobile app, or phone is really going to be the way that you're going to have to find out who's accepting the physicians and therapists that your child uses. And so then you're really going to want to research the plans. There are 6 plans. I believe in Cabarrus County, only 5 of them are available. One of the more common ones is going to be the Blue Cross Blue Shield, which is Healthy Blue. They are working with the Atrium Network and Novant, so we feel that a lot of families in our area will probably choose that. But look through all of them and make sure that it's going to cover what you need. And the way, again, to do that is to really look at those, take your time, go through the app, the website. So why is this, what's covered and what's different? What is going to be different than having traditional Medicaid? So it still is going to cover your doctor visits, your supplies, hospital visits, testing, all the behavioral health care that is outpatient, therapies such as speech, OT, physical, prescriptions, hospice, eye care. One thing that is new is they're going to integrate more care management into practices to help families with referrals and different things that might be available in your community. I think that's going to take a little bit of time to develop that, as it's not fully developed, even though they are advertising it. But some of the things that those care management resources are going to be looking at is these extra benefits. So really looking at whole family wellness, youth programs, education about different diagnosis. You can see some of the other things. What's going to be interesting too is they're going to be offering more alternative healing, chiropractic care, different things like home delivered meals, things that you might be able to tap into, parent peer online support. It's going to be really interesting, and we're hopeful that this is going to be very helpful to families to have those extra benefits. So let's kind of review again ways to enroll before May 14th. So doing that research first, going online, looking at those plans, or using the app. You can use that for research, and if you're more comfortable with filling out the packet that comes in the mail, that's great, but just really, really do your homework on making sure that your providers are in those plans. I've been doing a lot of discussing with different providers in the area to find out, what they're taking. And I will be honest with you, most of the providers in the area aren't even sure. They're like, especially a lot of the Atrium providers, they are waiting for management to give them the information that they need, and they don't know. So if you call your doctor's office and say, well, which Medicaid plan are you participating in? There is a good chance they're not going to be able to tell you. So your best bet is to go through these online resources. So I'm going to pause right there. And there was a couple questions in the chat. I'm going to address those before we go on. And then I noticed someone had their hand up, so we'll get to that as well. Allie said, I put respite because I couldn't see the file. Oh, she emailed me privately on that one. But I will get back to you, Allie, on that. But if you are receiving respite, that is an enhanced service, which will put you in Medicaid Direct. So anyone receiving respite, you're going to want to stay in Medicaid Direct because the managed Medicaid plans will not cover respite. And then Sherry asked, is there ever going to be help for parents who are not eligible due to income? Newly on the wait list, so many of us need help. So unfortunately, Medicaid is based on parent income when the children are under the age of 18. The only programs that are available that don't count your income is the innovations waiver, which you're on the waiting list for, and Cap C, which you have to qualify for under being medically fragile and having the need for nursing to come into your home. Michelle asks, how do I choose for my older son and my husband? My younger son needs to fill out the packet indicating that one of our kids has waiver services. So the children that are on, or adults that are on the waiver, everyone, first of all, should receive a different packet. Or if they send one letter, it should list every member of the family that's on Medicaid and then say managed care or Medicaid Direct. For anyone that's on Medicaid Direct, there should be no action that you need to do if you agree with that. For everyone else that's on the Medicaid managed care plan, you're going to have to fill out, whether it be online or within that packet, the enrollment. Not everybody can pick their own plan. So what's good for an adult may not be good for the child. So everyone can pick different, and you really want to pick based on your doctors that you use. And so she asked if innovation waiver families do not need to enroll, do we still need to fill out the packet? Oh, yes. You should. It should not require you to fill anything out if your child's on the waiver. It basically should say you are enrolled in Medicaid Direct for this child and no action is required at this time. The other question is, will we have to recertify each year? If so, will that be through the county services site or a new system? I will be honest with you, that has not been confirmed by the state if we're going to have to redo this every year. I think that there's probably going to be a renewal in the same way that, if you get insurance through your work, you have to re-enroll every year and decide if you're going to stay with that plan or get a new one. I imagine this is going to be the same. It may hopefully be a little simpler, but I do anticipate that coming down the pipeline. Let me see where I left off here. Okay, I think I might have grabbed all those chats. Did anyone else want to unmute and ask? And I see Michelle went to the app and it only had my name on the list. And so these are the things that we want to check on. If you do not see your children or your husband, anyone in your family that should be on it and they're not showing up, you want to address that now. You want to contact them through probably a phone call if it's something like that to try and speed it up. I don't know if there's an availability on the app or the website to really ask specific questions, but this is why you want to take the time right now and check on these things. So I will pause if anyone wants to unmute.
This is Sarah. I have a question, Sarah Ojo.
Sure.
Yeah, the reason I asked that about do you need to still fill out the paperwork is sometimes the details of the communication in those letters and through seminars like this are a little confusing because on one hand it says you do not need to enroll, but then it says you will be getting a packet, and if you do not complete it, you will be enrolled, the way they want you to. So it's not really clear. Do you need to send something back? Do you need to fill it out? And so then those questions could take hours to have answered. It might be really nice to have that clarified in that way. So these calls are really important. I just want to undermine from my perspective, from a parent's perspective, because it gives the opportunity to ask those questions. Unfortunately, everyone's not able to be on these sorts of calls that may need to know that. And it's extra time and extra work, not only for families, but also for you all at Medicaid or whoever's managing this.
So yeah, I want to clarify, first of all, I have no affiliation to Medicaid. This is being this is Amazing Grace Advocacy, and we are an agency that does case management to help families through support and navigation. We are providing this info because we agree wholeheartedly the information they're sending in the mail is very confusing. And we have gotten different answers from calling Medicaid directly on all of this. So if on the paperwork that they send you, it says you are enrolled in Medicaid Direct, you do not need to take action.
As a
Then
part of advocacy, I'm sorry, I'm interrupting you, but as a part of the advocacy, do you all give feedback about what you're hearing from families or have an avenue to do that? And the reason I ask that is even when my son transitioned, he's on Innovations waiver. We were on the waiting list for 16 years with in-home medical care. He was on CAP, but we never anticipated, and it was just really fortunate that I kept him on that waiting list. But we thought at the time when it was MRDD, we would never need it because he has lots of complex medical conditions and actually requires a nurse, full time in order to sustain his life. And, we never thought we would need this waiver until he became 18. And oops, there's no more Cap C for adults unless you're on a ventilator. So, and yet he's a college student at the same time, and he can't do his own feedings. He can't tolerate feedings. He's underweight. There's so many complex issues, as where no one perfectly fits sometimes into the program, so to speak. And, as families navigating, and I'm a healthcare worker and was a social worker before I was a healthcare worker who's navigated, Medicaid hearings and appeals and that kind of stuff. And still, I find it very confusing. So if I didn't work in healthcare or English wasn't my first language, I think I would be totally lost. And I know you probably see this a lot.
Absolutely. So to answer a couple of questions, first of all, I do advocate at the state level, and I am sharing parent feedback that we need more information. There's a lot of confusion. And so I'm doing the best I can to just disseminate the information I'm given.
Sure.
In my opinion, the rollout of this has been difficult because it started a year ago and then it got pulled due to COVID. And then they kind of just rolled it back out with not a lot of forewarning. And so I can promise you that not only as parents and as agencies we're confused, but the providers, so our doctor's offices, right?
Yes.
They're equally confused. And that's part of the problem because they're not all fully enrolled in these plans. So some of you may be going on the app or whatever and looking and can't find your provider. I'll be honest, some of you might see Dr. Wenning, who is one of our psychiatrists in the Cabarrus County area. When you go on the app right now, it's saying that he is only going to be accepting or working with NC or Medicaid Direct. So that's a huge problem because I would say, there's probably 50% of Cabarrus County's special needs youth that see Dr. Wenning that are not on Medicaid Direct. They're going to be under the managed care. So I actually emailed
Well,
Dr.
Medicaid
Wenning.
doesn't pay enough. That's where our Republican legislators want to cut, and we need to be voicing to them because they don't want to increase the funds for Medicaid. It's a big problem.
And so Dr. Wenning, how he explained it to me is that when they're under the big umbrella of Atrium, they don't have any control as individual providers of what's going on with who they're paneling with, right? So he's hoping that they're in process of getting all of those contracts with all of the different plans taken care of. But I just want to let parents know that if you don't see your provider, you might want to make some phone calls and recheck on a daily basis because it is changing rather fluidly. But one of the other questions on here, or two questions, is my youngest will be 7, so would have been transitioned to NC Health Choice, so he will qualify for Medicaid managed care. Yes, NC Health Choice will be placed into Medicaid managed care. And the other one is, I got a letter, my daughter is on Medicaid Direct, but they say she can also choose a plan. Do I stay or choose? So a lot of parents have seen that. I would say the most important thing is to look at your providers. Most likely, you're going to want to stay on Medicaid Direct, because if they're receiving any kind of higher level of care, in other words, anything above outpatient therapy, you're going to want to be in Medicaid Direct and be continuing to work with Cardinal Innovations. So with that, I'm going to go to the next slide. We'll have some more questions in just a minute. So again, Medicaid Direct, this is so confusing, right? If you are staying in Medicaid Direct, nothing is going to change at this time. You are still going to have Cardinal or Partners or Sandhills, whoever your MCO is in your county, you're going to continue working with them. So if you have a care coordinator, if you are receiving high level of services, that will all stay the same. It's going to change though in 2022. They are not letting anyone know what that change is going to look like at this time. So stay tuned. When we find out, we will share it. The other thing to be aware of is there are several counties that are disengaged or requesting a disengagement from Cardinal. And what that means is they want to stop using Cardinal as their Medicaid MCO and change to a different one. So I'm going to use Cabarrus County as a example because that's where we're largely based out of. The county commissioners and DSS made a request to Raleigh, the secretary, Mandy Cohen, to allow Cabarrus County to stop working with Cardinal and switch to Partners Behavioral Health Care. That request has to be reviewed in Raleigh. It has 90 days to be either approved or denied, and I believe that that date is at the end of May. So in the middle of all this going on, if the secretary, Mandy Cohen, approves this, that means there's going to be another transition for all of us that work with Cardinal or are served by Cardinal, and we're going to be transitioning over to Partners Behavioral Health. There is pros and cons to this. There's a lot of concerns with this. We are working with that team. I have already made connections and had some meetings with Partners, and we are continuing to work with Cardinal as well. So we will help families as best as we can if that does occur, and to make sure that there's no gaps in services and that your child's services don't stop or that you have to change providers. So just keep that in mind that there's a lot going on right now. So I want to talk just a little bit about the innovations waiver and CAP-C because this affects so many of us, and I know that there is such frustration over the waiting list and registry. So in terms of how this affects Medicaid with this transition, if you are already on the innovations waiver or CAP-C, you're automatically Medicaid Direct. There's no disputing that. You do not want to switch out of that. You just stay the same. If you are on the waiting list, or the registry as it's also known, it does not impact your enrollment. So if you're on the waiting list, but they tell you that you're on Medicaid Direct, you're going to stay with that. If you're on the waiting list, but you are not qualifying for Medicaid Direct, you will go in the managed care plans. But when your slot becomes available, or you're in the process of it, you will be then shifted into Medicaid Direct. So it's a little bit confusing, but that is being taken into consideration. And I just want to talk for a brief moment about how to get on the registry and why that waiting list is so long. So again, like Sarah mentioned, a lot of this is our state legislature. The money for the innovations waiver and the CAP-C waivers comes from our state government. They determine the budget for it. There is only so many slots available in our state because the budget is what it is. And so the only way to open up more slots is for our state legislature to add more funding into that budget to expand the openings. Because the innovations waiver is a lifetime benefit, the only time that openings occur is if someone that was on it passes away, then their slot becomes available. Or if they move out of state, their slot becomes available. Otherwise, we are solely dependent on the North Carolina legislature to add funding to the budget for the innovations waiver. If you have a child that has intellectual disabilities or autism, and they are going to need assistance in daily living skills, they will likely qualify. What you need to have is a psychological evaluation that is less than 3 years old that shows an intellectual disability and or autism that affects their ability to be self-sufficient and functioning daily living skills. If you think that your child falls into that category and you're not yet on the registry, we are happy to help you sort through that and get on the registry. You can do it yourself by simply getting a psychological evaluation and then submitting it to your MCO, such as Cardinal Innovations. Their website has some information on how to do that. We can get it done a little bit quicker at Amazing Grace, and we're happy to help families do that as well. CAP-C is for children, again, that are medically fragile, that might need nursing care. It's a much more tight criteria of who qualifies, and the process to get enrolled in CAP-C is a little bit more complex. I should say a lot more complex. So if you think that your child might qualify for either one of those and you want some assistance, we're happy to help you if you want to send me an email or go through our website and contact us. Real quick, before we open up to questions, it's always the big debate about the income guidelines to qualify for Medicaid. So if your child has a disability, that is not an automatic qualification for Medicaid. You have to come in these income guidelines. It hasn't been updated since April of 2020. There is some legislation being introduced currently at the federal level to increase Medicaid expansion across the entire United States. North Carolina does not have Medicaid expansion. We're one of, I believe, 11 states that has not done that yet. So if that's something you feel really strongly that needs to happen in North Carolina, email your federal and state legislators and let them know you need that income raised, because we've got to get these kids on Medicaid, because some of the services that they need are only available if they have Medicaid. It's not even a matter of affordability. It's not even available to most of our kids. So with that, I'm going to stop sharing my screen and open it up for questions. We've got about 10 minutes if you'd like to use the chat, or you can simply unmute. And I'm looking at the chat. So Trip, hi Trip, nice to hear from you. 2 questions. When will we receive these letters to go online and start the process? So they were supposed to start rolling out this week. I have had a couple parents say they've received them. I personally have not, and I have 2 kids on Medicaid. So watch every day in the mail. It will come from DHHS. And so if, again, to see if they qualify, if they're, think of it this way, if your children are receiving outpatient therapies, meaning you go to an office or you're doing telehealth, that is going to be Medicaid managed care. If you have a therapist coming in your home or telehealth through intensive in-home, family-centered treatment, MST, any of those higher level therapies, then you're going to be Medicaid direct and stay with Cardinal. If there's any, if you guys have a lot of questions that you want to go through individually, probably send me an email, and I'll do my best to answer them. And I'm seeing some hands up. So Allie, do you want to go ahead and unmute? Okay, maybe Allie's not with us. How about Michelle? Did you still have a question?
Yes. Okay. So I'm actually doing this and I'm chatting with somebody on Medicaid because they're telling me my eligibility is still pending. We're on Medicaid, but they're saying it's still pending. But I actually talked to somebody the other day and they said that it's extended for 6 months. So now I'm confused about that. But I was able to go online and do it for myself, but it didn't see my husband or my older child. My older child doesn't have a disability. It's my youngest one that does. So what do I do? Do I have to, I signed up, is it because I signed up for my, like, I have a username and password? Do I have to make a username and password for my husband? And then do I have to make a username and password for my son too?
You shouldn't have to. It should fall under, because here's why. The whole family's eligibility is based on the family income.
Yeah.
So it should fall all under the same family. What I would recommend is if you're in the middle of eligibility phase, I would stay in close contact with your county DSS. Like if you have an assigned social worker,
I do. I called her like 3 times. She hasn't called back.
Yeah, unfortunately. And sometimes what is good is to ask for an email. They respond better to email than they do phone, and it can save you a little time too. But that's what's going to be so hard with this whole thing, is that there's a lot of people that are kind of in a gap, right? You're waiting for eligibility. My guess is that if you're waiting on eligibility, once it's awarded, you're going to start out in Medicaid managed care. And then your primary care doctor is going to determine if there's anybody with disabilities that needs a higher level of care service. They will then go through the process for you of getting you transitioned into Medicaid Direct.
Yeah, like when it says on the paperwork that my youngest one, my son Thomas, he has Down syndrome, but my son Jackson, who's the older one, does not. So I have to make a decision for him.
Right.
For the Medicaid Direct, like Thomas will still have like the same doctors and everything like that. I don't have to do anything right now for him, correct?
That is correct. Any doctor that you were seeing that was covered by Medicaid under, like if you were going through Cardinal or Partners.
For Cardinal, like I don't have anything. The only reason we have Medicaid right now is my husband lost his job for a year, so we didn't have insurance. So I applied, and we got Medicaid for the whole family. And then Thomas has Down syndrome, so that's really good. But now my husband's back up working. We have private insurance, but we still have Medicaid, and they have extended it. And I'm not going to say no, that I don't want it, especially for Thomas. I think he needs it.
Right. And so, and I see that there's a question regarding the process to apply and determine eligibility for Medicaid. So it is, and I'm going to go back to sharing my screen. And I'll go down to this slide to show you eligibility. So Medicaid is 100% based on, based on your income. So when you look at the income guidelines, if you have a family of 4 and your children are between the ages of 6 and 20, you cannot have income higher than $2,904. If your income is between $2,904 and $4,607, you can be eligible for NC Health Choice, which is another form of Medicaid. It doesn't cover quite as much, and you do have some copays with it, but those are basically the income guidelines. The only way around it is if your child receives a waiver, the innovations waiver or the CAP-C waiver, that is the only way around it. So if you make more than this amount of money, you are not ever, ever, ever going to qualify for Medicaid unless you can get on the waiver. So if you think that your child has a severe enough disability that they would qualify for the waiver, get on that waiting list as soon as possible, because it is on average 7-year wait, because the budget's not high and there's a lot of people already on it. And that's why it takes so long. So hopefully that answered that. Ellie had a couple of questions in the chat box. Appealing it. So if you feel like you are placed in the wrong program and you want to appeal it, there is a system for that, but no one has done it yet, right? Because it's all new. So I don't have a strong opinion on how successful that might be. And if doctors are not networked, so that's the important thing here. Pick a plan that covers your doctors. If they're not in there, call the doctor's office and see if they're in process of it, just so you can pick the right plan. Hopefully, all of the doctors you were seeing before will get into another plan. But I want to caution everybody, if you are seeing any Atrium doctors, do not pick United Healthcare. None of the Atrium doctors will be participating in that plan. And who determines the higher level of care? So it's based on the types of therapy and the amount of services they need. DHHS will be determining that. So again, if you're doing ABA, there is a certain amount of ABA that's going to be covered under the managed care plans. And then there's another level of ABA that's going to be under Medicaid Direct. So that one's going to be tough if you're already in that. That's something you want to discuss with your ABA provider. And how do you apply for the waiver? You have to have, first step is you have to have a current psychological evaluation that is less than 3 years old that states in the diagnosis that your child has an intellectual disability, meaning that their IQ level is below 70, or they have autism. With the autism diagnosis, though, they have to meet 4 of the 6 criteria that shows that they're not able to care for themselves doing daily living skills, that they would need a caregiver. If your child qualifies for that, you then take that psychological evaluation and you submit it to the MCO, which is Cardinal or Partners. On their website, there is a portal that you can do it electronically. You can email it to them, or you can call them. There's a registry, it's called the Registry of Unmet Needs, is the waiting list for the waiver. So it's a little complex, it's a little confusing. If you need help with it, reach out to us at Amazing Grace. We can help families get it done really quick. We have a portal that we can submit your psych eval through, and it's super quick. So again, feel free to reach out to us. You can go to amazinggraceadvocacy.org, and there's a Connect with Us tab. Click on that, send us a message. We'll do the best we can to help you. So with that, it is 1 o'clock. Our hour is done. If you would like to receive this recording and listen to it again or share it with a spouse, I can send that out to you. Just simply send me an email. If you registered, I have your email. If you have questions, please feel free to reach out to me. Email is probably the best way. And with that, I'm going to stop the recording. And if anyone wants to stay on after for a few minutes, I've got just a few minutes that I can hang around. Otherwise, thank you so much for attending, and I will email out the recording.